Hello everyone, so welcome back. This is Health Economics. In chapter 11, we are going to discuss about the problems in the insurance markets, which is what we call the moral hazard. So in this chapter, we are going to define what is moral hazard, and then we will try to think about how to limit moral hazard in the health insurance market. And by giving some evidence of moral hazards to illustrate the problem in the health insurance market and what is the trade-off between moral hazards and risk reductions. And then we would like to talk about some of the upside of the moral hazards. So in general, what we call moral hazard, it's basically a behavior change after people purchasing the insurance. So in general, we have learned in chapter 7 why people buying health insurance. So health insurance, basically it's a product that can generate utility for consumers by reducing the painful uncertainty. So by reducing the risks in life, obviously, individual customer would be able to get a higher level of utility. However, because of the asymmetrical information setting in the health insurance markets, it creates another problem, which is what we call the moral hazard. So this is one of the major concerns in the health policy in, I would say, any countries in the world. We will discuss the national health policy and the national health insurance policy later in chapter 15 to chapter 19. But here in this chapter, we would like to briefly go over these moral hazard problems in general. So the definitions of this moral hazard, it's basically the tendencies for insurance against loss to reduce incentives to prevent or minimize the loss of the cost of loss. So this moral hazard term has actually been mentioned as early as in 1862, which is one of the handbook for insurance actuaries. It's called The Practice of Fire Underwriting. The author of this book actually used the term to distinguish between natural hazards and moral hazards. So there are basically two kinds of hazards that could cause a fire. One is by nature, which is like lightning strikes that causing a fire. This is what we call the natural hazards in life. On the other hand, there is a different kinds of hazard, what we call the moral hazards. So the moral hazards basically it's a carelessness that can lead to a fire and are the results of decisions by human usually. So over time, the term has come to encompass all the risky changes in behaviors that result from insurance coverage. So generally speaking, again, we have defined the moral hazard as the change of behavior after people getting the insurance. So that means the insured people, usually they would take risks with the health that similar to uninsured people would not take. And the demand for more expensive treatment from the doctor when they get sick will be paid out by the insurance company. So the moral hazard is the downside of health insurance because, well, ultimately it will driving this society level of health care expenditures to a very, very high level. And that's basically one of the reasons that explain why we are paying such a high healthcare costs to get access to the service in the United States. So these moral hazards always come with a very similar fashions of patterns. So in general, we can actually define those simple patterns. So at the beginning, an individual will face some risk of a bad event. We call it X could be a bad event like getting hit by a car, or maybe jumping out of a river and get hit by a rock, or maybe just going out on the streets on rainy days and get wet and then get sick. So event X basically are any bad events that could happen in their life. And his actions can increase or decrease its likelihood. So this individual basically holds an insurance contract that will help pay some or maybe all of the costs of X if it occurs. So this price of X is now lower. In response to price distortions, this individual changed his behavior in a way that increased the chance of X could happen, or increased the cost of recovering from X. So the insurance company cannot observe this behavior change after the person purchased the insurance coverage. And that's why there is a information asymmetry. Otherwise, the contract would have been written in a way to discourage the riskier behavior. So the insurance company, if they know that person after purchasing the insurance will get into a more riskier behavior, or maybe get into a more riskier event, obviously they would like to actually charge this person a little bit higher premium, or maybe just saying, well, I'm not covering with such and such action taken on the streets, so that it will prevent the person taking this risky behavior. And the individual's riskier behavior creating this social loss, because the costly event occurs more than it would have without the insurance. So obviously all these people getting hurt or maybe getting the service, well, it's not necessary to actually consume if they can actually keep the actions to be on the safe side instead of the riskier side. So after purchasing insurance, because of this behavior change, it becomes a social cost for the society to provide the service for these individuals. So in general, we have described some simple patterns in the case of moral hazard. But what's more important to note is some of these elements we found in the case of moral hazards, it's more important to understand. Such as there are three main elements we always found in the case of moral hazards. Number one, in most of the cases, price distortion is the cause of moral hazards. And number two, price sensitivities also drive people to take more riskier actions, even when they are being covered by insurance. And number three, asymmetrical information is always happens because, well, the insurance company will always have less information about the person's behavior than the person itself. So all these elements, it's necessary to have in order to form the moral hazards. So if one of these elements is not present in a particular context, well, moral hazard cannot exist. So, well, in general, of course, we can prevent some level of moral hazards by lowering those elements, such as if you talk about information asymmetries, if the insurance company can actually observe all the possible behavior J would take after purchasing the insurance, obviously the policy can adjust accordingly in order to eliminate those change of behaviors by charging maybe a higher premiums, or maybe taking out some of the coverage for that individuals. Well, in general, this will change the behavior of the individual who are looking for the insurance. But there are two types of behavior change that we would like to actually talk about. So not only moral hazards, it's special to talk about in the insurance market, but the way it get into the markets also it's interesting to note. So number one, people actually change the behavior after the purchasing behavior before something bad happens, and that's what we call the ex ante moral hazards. So basically, it's a behavior change occurred before the insured event happens, and make that event more likely to happen. So for example, you can actually think about once you bought the insurance for a home, you will more likely to leaving the stove on, and once you bought the health insurance cover for whatever sickness you have, then you will start skipping the flu vaccines. So those are the behavior change, even though the bad thing has not happened to you yet, but you will just change it the way it is. Another types of moral hazard is what we call the exposed moral hazards. So the exposed moral hazards basically describe the behavior change that occurred after an insured event happens and make recovering from those events more expensive. So for example, you can actually think about people who have a very generous insurance package. They will always choose to use the more expensive drugs or most expensive drugs in the market instead of the generic drugs. And also people who maybe hurt their knees, they have a choice to either have the painkillers and rest themselves to heal, or maybe to take the very expensive knee replacement surgeries. So when people actually know that they are being covered by the insurance coverage, well, obviously people will choose the most expensive procedure possible. So all these decisions after bad thing happens, it's actually what we describe as the exposed moral hazards. So in this case, obviously the exposed moral hazard will pose a very, very big social cost to our society, because the fact is people who are taking this riskier, well, not even riskier action, but people who choose to have this very, very expensive procedures or extra treatments, which is unnecessary to happen if they are being more careful or they are being more risk averse for not getting hurt. So those are the actions can be avoided, not to pose cost to the society, because at the end of the day, getting more expensive drugs, paying more expensive treatments or procedures, obviously the insurance company will not just stand there and not find a way to recover. At the end of the day, all these expensive treatments, all these expensive drugs that it's being used by all these people who are taking advantage of the moral hazards will be shared by every single one who buying the insurance in the pool. So in practice, moral hazard means everyone in the insurance pool has to pay for each other's riskier decisions and the overconsumptions of medical care. So after talking about all this concept, we would like to actually think about some technical solutions to this moral hazards, or explanations to the moral hazards. So we would like to use the graphical representations to describe this moral hazard problem. So let's start with this one simple example here and trying to discover how the moral hazard worked graphically. So this story began with this one individual who really loves cheeseburger. Well, of course, every cheeseburger this individual eats will increase the risk for getting a heart attack, because well, obviously cheeseburger is not something that we would like to eat every day. It's not a healthy food choice. So we would like to think about how insurance or buying an insurance will affect the consumption behavior of these individuals. So in general, we separate our analysis into two cases. So one is when this individual is consuming the cheeseburger and knowing the results of getting a higher risk of a heart attack without health insurance. And now this individual will consider the cost of every single cheeseburger that he consumed, include not only just the price of the burger, but also the potential healthcare costs that involve if he get a heart attack later. Well, the other situation is if this individual person actually purchased the health insurance. Well, obviously he will have to pay a little small amounts of premium to cover this coverage of heart attack care. So the cost for purchasing the cheeseburger now declines dramatically because, well, now this person don't have to worry about paying, let's say, $10,000s to do the heart attack surgery. Instead, well, the insurance company will cover. He only has to pay a very small amount of premium. So with the health insurance, obviously the cost for every single cheeseburger for this individual person will go down. So in this case, the social loss takes the forms of this extra money, labor, time, and efforts that the other people has to expend on caring for this person getting a heart attack, which caused by overconsumptions of the cheeseburger. So graphically, we would like to illustrate all this in one graph. Here, we have a diagram that illustrates the demand of cheeseburger for these individuals. So every time when we talk about economics, well, obviously, graph it's the most powerful tool to spit out the story. But not only just that, we always talk about supply and demand. So now we are talking about how this individual buyer of cheeseburger will behave. So that's why we would like to illustrate it by using the demand curve of cheeseburger for this individual. So first of all, let's talk about the graph on the right hand side. So we have C on the vertical horizontal axis, which represent the quantity of cheeseburger consumed. And on the vertical axis, we have the dollar sign, which is the price of the cheeseburger plus the potential cost for treating the heart attack. So basically, we are representing the cost of cheeseburger per unit by adding the cost of the burger and also the potential cost of healthcare in one number. So we have this demand curve represented by DC. So you can see the lines on the graph, DC, which is the demand for cheeseburger. Well, let's talk about the points on this demand curve. So this demand curve, just like all the regular individual demand curve, it represents the maximum willingness to pay for this individual for every single unit of cheeseburger. So in general, we can actually understand if we are going to ask this person to pay a very, very high price for every single one burger that he has to purchase. Well, this individual will only willing to buy very, very small amounts of cheeseburger. Versus if the price of the burger actually dropped, then this person would like to actually purchase more. This is basically explained by the law of demand. So in the diagram here with insurance, the effective price per cheeseburger actually fall from PU to PI. So you can actually think about PU basically is the price when this individual is uninsured. So with no insurance, well, this person will have to pay the full price of the burger, which is the cost for buying the burger, plus the potential cost for paying the bill for this heart attack surgeries. So the price of this every single individual burger will be extremely high because, well, adding, let's say, $10,000 by eating 10 burgers, well, obviously it adds up the cost. However, the insured individuals will have to pay only a much lower price, which is represented by PI here in this diagram. So with this low price, obviously, well, this individual would like to consume more of this cheeseburger. So point A in the diagram basically representing the individual's choice of consumptions for cheeseburger when this person is uninsured. And point B, it's representing the situation when this person is getting a health insurance that cover for the heart attack surgery or heart attack treatments. So the price will drop and the quantity will increase. So point A, we assume this is a social efficient equilibrium, while point B is the outcome with the insurance. So point A basically is the optimal choice for this individuals to get or to consume some amounts of cheeseburger given the full price that this person has to pay in the market. Well, of course, an extra cheeseburger consumed between point QU, which is the quantity uninsured, and QI, the quantity with insurance, result in more costs than they're worth. And in this case, we can also identify by giving out this very generous, or maybe just in general, a fair or maybe a full insurance coverage for these individuals. Well, this person will definitely consume more of cheeseburger because he knows it that he only has to pay a very, very small amount or even zero amounts of dollar on the potential heart attack treatments. Well, not only we know that this person will take action to consume more of cheeseburger when the price drops, but we can also identify what we call the social loss. So in this case, we can identify the extent of price distortions. So the distortions here basically represent the price that it's being the price of burger that it's being covered with the insurance coverage. So the vertical distance between PU and PI basically showing that extent of price distortion. So this is basically the price it's being covered by the insurance company when something happened to this person, with or without the insurance. And you can also think about the distance also help determines the social loss from this ex ante moral hazard. So the social loss is being represented by this triangle-shaped triangle in the figure. So this is the result of an ex ante moral hazard. When we talk about it, it's basically before something bad happened to this person, but because of insurance that he bought, obviously he changed the way he purchased cheeseburger. So this social loss takes the forms of extra money and labors, times and efforts that other people will have to expend on caring for this individual who have eaten more cheeseburger. So obviously, this is basically extra cost that the society have to pay in order to provide a service for this person if he gets a heart attack. So by thinking about this concept here, you can actually refer to other cases where the social loss can be created, like for example, just like a fancy steak dinner that's only worth ordering when someone else is paying the check, or an upgrade to a first class ticket that only makes sense if your company is covering the cost. So this extra cheeseburger this individual person consumed, it's resulting more than what this person is truly needed, or what the burger is truly worth. Not only the diagram representing the social loss to the society from this insurance case, but we can also analyze from this diagram how price sensitivity will also get into our conclusions here. So the angle that you see in the diagram between the dotted vertical lines and the demand curve, which is DC, where there's an arrow pointing on these two lines that sets extent of price sensitivities. So the angle between the demand curve and the vertical represents the extent of price sensitivity, how sensitive this individual to the price of burger. We talk about the price sensitivity, which is represented by the elasticity of demand. We're not going to extend that technical stuff here in this chapter, but we just basically say, well, when the person is price sensitive, the lower the price it is, well, the even more that person would like to purchase. And also work the reverse. If the person is very price sensitive, when the price of the goods go up, well, he will buy extremely more or extremely lot less than what he's supposed to be comparing to price. Well, when the person is price insensitive, obviously, well, when price change, well, the quantity of goods purchased will not be changing by that much comparing to the price. So back to the topics here, well, price sensitivity also make a very big influence to this analysis here. The larger the angle it is, well, that basically in general means a more responsive behavior is to the price distortions. And the larger the social loss would also result from moral hazards. So let's take a look at two extreme cases here to kind of understand how price sensitivity will also get into the problems of moral hazards. So in the first case here, on figure A, left-hand side, we are describing where the price distortions and the price sensitivities are both huge. So the insured individual bear only a very, very small amount of cost for taking care of this heart attack treatments. So as they are quite price sensitive in these markets, so they will respond with even more frequent trips to the local burger joints to buy more cheeseburger because they know it. Well, all the costs will be covered by the insurance. So that means the price, the total price of burger that they have to pay, it's even lower. So with even lower price, well, if that person is very price sensitive, so this person will definitely buy even more of cheeseburger in order to gain utility. So this is a result of large social loss in the markets. So another case that we can also compare to the first one, which is diagram B here. So this figure here actually represents when the price distortions and the price sensitivities are minimum. So the insured individual bear most of the cost of the cheeseburger in this case, right? Because maybe the insurance coverage only cover, let's say, 50% of the cost of the heart attack. The rest of the money still have to pay by the individual. So the price of each burger will increase. But not only just that, we also representing if it combined with a very, very low sensitivities of price of these individuals. That means, well, the price drops, the person will not react to the price or responsive to the price change in the market. So that means he will not buy as much as the price decreased in the markets. So we talk about the price sensitivity here. It's because, well, it has a very, very important influences to the model. With a combinations of high price distortions and price sensitivities, it creates a huge social loss to the market. On the other hand, if we can actually minimize the price distortions and also making it less price sensitive for people to purchase the goods, the combinations of the two will minimize the social loss to the society.
Well, since both the price distortions and price sensitivities of the product or service become a very important factor in the case of more hazards, well, we would like to actually think about what determines the level of price distortions and price sensitivities in the market. Well, the extent of price distortion basically coming from the fact that how complete the insurance are. So the completeness of insurance determines the level of the price distortions. So if the insurance contract is full, for example, any insurance or any health problem will not affect the consumer's income. So the price of all these treatments or medical expenses will be covered by insurance company. Well, this means the price of any injuries or illnesses is zero. So the price distortion in this case will be extremely large. Comparing to some partial insurance contract, the consumers must pay some amount of out of pocket for the care. So the medical care in this case is not completely free for them, so the price distortion becomes smaller and the moral hazard problem becomes less severe in the market. Well, the level of price sensitivities in the markets of insurance depends on mainly on the nature of the risk being insured and how controllable of this risk is. So there are some risks are basically impossible to control and are never the result of the carelessness. So for example, some of the risks we call the natural hazards. Right? So something that happen naturally, like you are having this genetic disease from your family, or this is entirely out of your control. You don't want it, but somehow it's determined even before you were born. On the other hand, we might actually have some risk that it's totally controllable, such as the risk being cut yourself with a knife when you're sliding the bagel, or maybe making an error on your taxes. So those are the risks that can completely avoid in life when you're putting a little bit more attention when you're doing those things, or maybe be a little bit more careful. In between are the risks like suffering a heart attack or being involved in a car accident, which are the result of both the natural hazards and the individual choice. So insurance go against different types of risks tend to create different amounts of more hazards. An insurance policy that go against some natural hazards, like the genetic disease, since this kind of disease will not induce moral hazards because it does not affect the insured parties' actions or decisions. Putting in another way, it's basically having this insurance contract to cover the genetic disease. It's not going to create any new instance of the disease by these individuals. If this individual has it, well, somehow they will have it by buying extra or supplements insurance to cover those diseases. It's not going to make this individual wants to have more of this disease, or maybe taking even more riskier actions to have those diseases, because it's just come from the nature that they have it. On the other hand, the insurance that cover those error can be avoided. Obviously, it will make the problems worse because, well, now being covered with the insurance, the individuals will usually be a little bit more careless, or maybe be more risk-taking after they are being purchased, after they purchase the insurance coverage from the company. So the demand for this types of products or services, it's quite responsive to prices when things can be controlled in life. Versus price sensitivity will be relatively low comparing to those which is something that can totally unavoided in life. So after talking about the price distortions and how price sensitivity, they both contribute to the level of moral hazards, we would like to talk about the last elements that we have discussed, which is the asymmetric informations. So obviously, the asymmetric information is one of the key elements in the case of moral hazards. As long as there is asymmetric information between the insurer and the insurance buyer, which is the customer, moral hazards will always exist. So think about how the asymmetrical informations can give rise to the ex ante moral hazards and the exposed moral hazards. They are quite similar in some way, but then they are actually not identical. So for example, there is no way to avoid moral hazards with the asymmetric information with the ex ante moral hazard, because there is no way for the insurance company to actually change the premium of the insurance coverage whenever the individual is trying to do something dangerous. So for example, when someone decided to go on a trip to Hawaii, let's say, well, the insurance company is providing this coverage. Let's say, consider this person will go out there to swim. There are some risks to take. This person will go on driving on the roads, might get hit by a car. Those are the things that's standard to consider when they are trying to offer this traveling coverage. However, there is no way for this insurance company to change the premiums whenever the individual decided to actually go on scuba diving, or maybe go to a parasails, because well, those decisions actually made at the time when he or she trying to do something for a potential risk that could involve. So yes, technically, in practice, it's not very feasible for the insurance company to actually avoid this kind of asymmetric information in the markets, because well, there's no way that the insurance company will count every cheeseburger the customer eats every week and change the premium accordingly. There's no way for them to actually send some spies to follow their customers whenever this person is doing something dangerous, and then they would immediately change the premium for this person's. Just in general, not practical and unrealistic for the company to take those steps in order to avoid the asymmetric informations for ex ante moral hazards. On the other hand, it's very difficult to actually eliminate what we call the exposed moral hazards. So the exposed moral hazard has a slightly different information. Instead of talking about action taken before something bad happens, the insurance company can charge different premium. It's very difficult to consider the necessities of any given medical treatments for the patients or their customers when something bad actually happened. So insurers have a very, very difficult time to figure out, well, whether is it necessary for someone to visit the doctor 12 times a year, or is it logical to actually do a knee surgery instead of taking the painkillers. All these decisions, it's made by the customers itself when they see the doctors, right? Whenever they are trying to figure out the solution for themselves. So it's not a very feasible way for the insurance company to figure out for their customer. This individual's information's asymmetries, unlike the ones that we discussed, this actually it's a serious problem that causing the moral hazards in the case of ante moral hazard and exposed moral hazards, and those are the two that cannot be avoided in an easy way. So to sum up these sections, there are again 3 conditions needs to be held in order to have the moral hazards occurred in the insurance market. Number 1, the cost of the risk or wasteful actions to an individual is reduced. usually as a consequences of insurance. So when people buy insurance, they know the cost of this risk or wasteful actions will be reduced, right? Those are the nature of insurance, basically. So when this condition holds, well, more hazard begins to happen. And number two, asymmetrical information prevents insurer from adequately pricing the actions taken by the customers. So there's a very difficult way to figure out whether the customer is doing something dangerous after purchasing the insurance coverage, or when at the times when they decide to use those healthcare services, what is the best, most effective ways to treat the illness or the sickness. Those are the asymmetric informations that actually does not allow insurer to make the right decisions to charge on the premium. And number three, when the individual responds to the price distortion by changing his behavior, either by taking more risks or maybe demanding more covered goods and services, this is basically the final stage of the more hazards that has to hold in order to causing the problems in the market. So those are the three conditions that we have studied in this section, and those has to be held in order to create or allow to more hazard to exist in the insurance market. Now the problem is with this big issues of more hazards. We know it's going to create this social loss to the society. Someone out there will have to ultimately provide those extra service, extra costs for time, efforts to provide those healthcare services to the individuals who are taking more riskier behaviors in the markets. Well, we want to know how we can eliminate or limit the moral hazards in the insurance market. There are some way has been suggested by the book. So the extent of moral hazard depends on both how sensitive demand is to the price and the amount of price distortion caused by insurance. So the insurer cannot alter the customer price sensitivity because price sensitivity, it's very personal. One's price sensitivity can be very different comparing to the other. So there's no way for them to actually, for the insurer to make an effect or influences the consumer's price sensitivities. But what they can do is to reduce the price distortions due to the insurance. And that's the reason why we see all this policy of insurance appear in our life nowadays. So those policy that reduce price distortions include co-payments, co-insurance, deductibles payment, and monitoring. So let's think about all this for individually. So cost sharing basically include co-insurance and co-payments. So the co-insurance and co-payment basically are two types of insurance contract provisions to maintain a positive marginal cost, so to increase the cost of the goods for the insured. So these plans effectively limits the insurance coverage so that they are no longer full. So that means the co-insurance, co-payments policy basically it's designed to reduce the fullness or the completeness of the insurance in order to avoid people having these huge price distortions in the demand. So co-insurance work as an insurance provisions in which the enrollee pay a percentage of each medical bills and the insurer cover the remaining portions. So the co-insurance sometimes will set for the customers of the insurance to pay, let's say, 5% of the total cost for the heart surgeries, or maybe 8% or maybe 10%. So it's by percentage that the customer has to pay. The co-payment, on the other hand, is the insurance provision in which the enrollee pay only a fixed amount called a co-pay in the market. So for example, if the heart surgery is costing, let's say, $10,000 in the market, the co-payments or the co-paid for this insurance coverage is $500. So this individual who wants to have the heart surgery will only have to pay $500 out of the pockets to get this heart attack surgery. In the case of co-insurance, obviously, well, it's by percentage point. Let's say if the percentage of money that the customer has to pay is 10%. So that means out of the $10,000, 10% is $1,000. So that means, well, the individual will have to pay $1,000 out of pockets for this $10,000 of heart surgery in life. Well, both work in a very similar fashion. It's basically designed to increase the level of payments for the insured customer in order to reduce the price distortions. So the cost sharing insurance basically working as the following ways. If we look at the diagram A right here, where the full insurance suggesting the white triangles in the diagram is the social loss. Without the insurance, obviously the individual will consume at point QU. Every unit of medical care he consumes will provide at least as much of the marginal benefit as the marginal cost, which is what we call the efficient outputs. But with the full insurance, in this case, his marginal cost of the medical care from his perspective fall to 0. So in this case, his effective demand curve is DF. And he will consume at point QA in order to maximize his utility. Let's suppose if the insurance firm now institute a co-payment of PC, which becomes an effective price for each episode of care. So from reading off the demand curve, we find that this reduced the consumer demand to QB in the diagram. So this reduction of quantity, it's being suggested by the demand curve where the individual will have to pay a higher cost when he or she getting into a troubles of having this healthcare service. So note, such co-insurance and co-payment reduce the social loss at the expense of increased uncertainty faced by the consumer who are no longer fully insured. In another way to think about the reductions of social loss, we can also think about how co-insurance plan will also affect the decisions made by the individual buyers. So by contrast, a co-insurance plan actually rotates the insured individual demand outwards. So by looking at the diagram C here, we observe that it imagines the consumers starting at full insurance, where 0% of co-insurance that he has to pay. His demand curve is then vertical since he faced no out-of-pocket costs for any services he consumes. But now the insurer pays 100% of the bills, and graphically the demand curve becomes a vertical line over point A. As the co-insurance rises, well, out-of-pocket price become closer and closer to the actual price. And the demand curve rotates backwards towards the uninsured demand, which is DU. At the extremes where the consumer has to pay 100% of the co-insurance, which is basically equivalent to no insurance at all. So in this case, well, both figure B and figure C that we have discussed uh, is the impositions of either the co-payments or co-insurance increases the marginal cost of an additional medical care to the consumers. And it lowers the quantity of demand for the goods. This reduced the social loss at the expense of increasing uncertainty faced by the consumers, who are no longer fully insured. So in addition to the co-insurance and co-payments, the insurer can also include something what we call deductibles in the insurance coverage plan. Deductible basically refers to the word as SS in British English. This is basically, it's a set minimum level of expenses below which the insurer does not help reimburse the medical expenses. So for example, it's possible for the insurance company to set a deductible of $1,000 for the coverage. So that means people who are buying this insurance coverage for the first $1,000 of this medical expenses, it will not be paid off by the insurance company. Instead, it will be fully covered by the insurance buyer. But anything that's beyond the $1,000, the insurance policy will help paying for the expenses. So deductible, it's can be applied to basically individual episodes of care. So that means for a heart surgery, maybe there's a deductible of $1,000. For cancer treatments, maybe there's a deductible for $3,000. So it can be individually applied to different episodes of care in the entire year of expenditures. Not only individuals' deductible plan can be set in the policy, but it can also be paired up with the co-insurance and co-payments. So for example, it's possible to have the insurance coverage set up a policy such as from the first region in the diagram, where the deductible regions explain to us for every single $1 of healthcare expenditures, the insurance buyer will have to pay full amounts. So the slope of this line is 1, because for every $1 that goes into the medical bill, the person will have to pay full $1. On the second regions of this diagram, whatever amounts of money that go beyond to the first regions, the co-insurance will kick in. So that means for example, after $1,000, the insurance company will start paying off your bill, but not the full amount. Maybe it will be 33% in this case of the co-insurance. The insurance buyer will have to pay. So that's why you see the slope actually getting smaller to 0.33, because for every $1 of healthcare expenses, 33% or 33 cents out of the dollar will have to pay by the insurance buyer. And at last, there is a third region called the catastrophic care regions, which is when the expense of these healthcare services will go beyond that some amounts of dollar. It will start be covered by the insurance company in full. So that means whenever things got very serious, you get into something that it's very, very involved with a very expensive procedure, then the insurance company will pay full after that amount. So you will see the slope of this region to be 0, because for every $1 you spend on medical expenses or the healthcare expenses, it will be fully covered by the insurance company. Nothing will have to pay out of pockets. So deductible, it's a very interesting way to actually eliminate or maybe to limit the moral hazard problem from insurance markets. Of course, the idea is to minimize the price distortions and to reduce the moral hazards by having people consider paying some amount of money when they get into some situations, right? So when they get a flu, for saying, they will now have to consider, oh, should I actually go to the doctor? If it's totally free, $0, they have to pay out of pockets. Obviously, for even small minor problem, everyone will go see the doctor. However, when they know that they have to pay some amount of dollars, they have to cover some expenses at the beginning, well, they will be a little bit more careful and cautious in order to decide whether they should use the service or use the medical service in the market. Finally, the moral hazard problem can also be resolved or maybe reduced by reducing the level of information asymmetries in the insurance markets. Some insurance company, they are trying to observe and guide the preventive measures the consumers take. So while others choose to supervise the medical care that the consumers receive in order to avoid both ex ante moral hazards and expose moral hazards. So what are some of the action taken by the insurance company or maybe the firm itself in order to keep people healthier without over using the medical services? So for the ex ante moral hazards, there are some insurance company, they are trying to provide or encourage the enrollee to exercise more and staying healthy. So Kaiser Permanente basically is one of the major American insurance company. They have a program called the Thrift, which they always providing yoga course online, motivational tips for dieting, and a lot of tools to find for the local markets in order to keep most of the people who enroll in the programs to stay healthy. And also, the employer who must cover the healthcare costs also offer money to reduce ex ante moral hazards, such as the Stanford University. They might actually provide employee with the annual cash payments if their employees complete like a number of tasks, including like a fitness test, a visit with the nutritionist, and maybe an on-campus athletic class. So those are the things basically designed to keep the individual enrollees to stay healthy. And another strategy is usually used to reduce the level of exposed moral hazard. It's what we call the gatekeeping. So the gatekeeping basically is a way to manage the healthcare expenditures and limits the high costs expenditure service to be suggested or maybe to be advised by the doctors. So there are many managed care organizations, what we call the MCO, that helps to guide through this gatekeeping practice. A typical system involved with medical care physicians to basically assess the students, not student, but assess the patients and decide how much care they would really need. So if a patient basically comes in with the headache, the insurance company doctors may actually send her away with only a prescriptions of painkillers instead of referring her to a very costly CT scan that she might actually not need. So gatekeeping, it's basically a top tactics that can substantially reduce unnecessary medical procedure, which we have referred to the social loss to the society. So even though they also have the potential to prevent patients from receiving the needed care or the necessary care that they really truly need, but the cost for involved with this gatekeeping tactic is still relatively small, so it's been very effectively controlling the cost of medical expenditures in the country, just like in the United States. We will talk about more of the gatekeeping tactics in chapter 18. So we will just kind of talk about these different strategies here, and then let you guys go with the readings later in the chapters. Well, after going over the cost of moral hazard and what is moral hazard and some of the limitations of moral hazard in the insurance markets, we would like to actually discover the questions, how big is moral hazard in the insurance markets? Is there any evidence that we can find in order to illustrate the size of this problem? So empirically, it has been a very difficult job to measure moral hazards in the insurance markets. Researchers, basically they suffer from the same information asymmetry that prevent insurers from eliminating the moral hazards, which is the behavior change are very, very hard to observe or very, very difficult to tell. But there are quite a few studies that we found some credible evidence of moral hazards in the insurance markets. So there are some studies that we would like to go over in these sections. There are three main health insurance experiments that we would like to go over. Two of them are from chapter 2, which is the RAN health insurance experiment, the HIE, and the other one is the Oregon Medicaid study. And the third one basically is a study done in Mexico. It's a study named Seguros Popular and Salud, which is a government-sponsored insurance programs for low-income Mexican citizens. So let's start with the ex-ante moral hazard. So again, the ex-ante moral hazard occurs when those with insurance coverage are taking more reckless behavior, or maybe taking on more risks in their life because the fact that they know they are being covered with the insurance. There are some indirect evidence that found from the RAN HIE study. So in this study, actually, there are some evidence being suggesting the enrollee with more generous insurance, they are indeed more reckless with their health. So some of the numbers speak for itself. For example, patients with full insurance, they are basically about 25% more likely to appear at the doctor's office or maybe hospital with a broken bone or maybe a dislocated joint. Same comparisons with the full insurance patients and partial insurance patients. The full insurance patient appear to have about 18% more likely to present with the serious tumor and 35% more likely to be hospitalized with the drugs or maybe alcohol abuse. So this evidence actually suggesting that the full insurance induce ex-ante moral hazards, specifically the behavior that result in occurring hospitalizations, such as getting frequent trips to Los Angeles, or maybe Robbie, or maybe doing some kind of riskier activities in life. But it's also possible the fact it's entirely driven by exposed moral hazards. There are other evidence also suggesting the same results, such as the case in Ghana. So what happened in Ghana was that the malaria, it's basically a leading cause of mobilities and mortalities in the country. It accounts for about 38% of the country's outpatient visits and 36% of the admissions into the healthcare facility. So it's a very, very serious problem in Malaysia. But there are some way to actually prevent being transmitted with the diseases. One of the most effective tools is to sleep with the treated mosquito nets. So the nets basically prevents mosquitoes to get into the beds in order to avoid transmissions of these diseases. So the study actually found the insured households actually less likely to use the mosquito nets, which is the key preventing malaria in the country, versus people who don't have an insurance. They are more likely, comparing to the insured households, they are more likely to use the mosquito nets. So obviously, in this case, again, we can argue that people with the insurance, even before they're getting the malaria, they will be a little bit more reckless in terms of preventing getting the malaria in the households. And lastly, we have this surveys in Mexico, or a study in Mexico, that also give us some evidence. The low-income Mexicans assigned to receive the free insurance, which is the government-backed insurance in Mexico, those people were less likely to get a flu shot and cancer screening. So again, the preventive care, it's being less used by those who it's being covered by insurance in Mexico. However, the preventive care, somehow it can get very, very tricky, because we don't know whether it's because people they are being covered by the insurance, so that they would like to use less because they know whenever something bad happens later, they will be covered by the insurance payments. Or sometimes we might actually see people with insurance coverage or more generous coverage. They will use more of this preventive care, because the fact that basically those preventive care costs will be covered by the insurance company too. So one way or the other, it's somehow trickier to talk about preventive care in terms of ex-ante moral hazard. But these three cases basically give us a very, very good examples of the ex-ante moral hazards that could possibly happen in the insurance market. Well, here are some evidence that basically connect with the examples from Rent's HIE survey. So as you can see, people with fracture dislocations, free plans patients, they are basically much more likely to visit the hospital comparing to the cost-sharing plans. 168 out of 1,000 enrollee will go visit the hospital with the fractures and dislocations, comparing to the cost-sharing plans enrollee. Out of 10,000 enrollee will go to the hospitals. So the ratio, it's about 25% more for the free plans, which is the full coverage plan. And for other treatments also, or other episodes, you can see the numbers are consistently higher for people who have the free plans comparing to the cost-sharing plan. Well, on the other hand, observing the exposed moral hazards, somehow it's less complicated comparing to the ex-ante moral hazards in the health insurance markets. While the ex-ante moral hazards usually reflecting the personal behaviors change that usually are very, very difficult to observe in the markets, versus the exposed moral hazards can be identified by comparing the groups with different insurance coverage levels and by studying the detailed records of what the treatments or benefits the participants receive. So one of the evidence that we found from the study is actually from the Stanford University study in April 1967. So the background of this study basically giving us some suggestions to believe the exposed moral hazards is quite large. So what happens back then was the university administrators increased the co-insurance rates of the university provided health insurance. So before the change of the policy, the Stanford faculties and staff, they pay zero or receive a free outpatient care at Palo Alto's medical clinics. However, after the change of the policy in April 1967, now the staff and faculties, they are required to pay 25% of co-insurance rates for the outpatient care visits. So in this natural experiment, well, there are two groups of people it's being created, which is one is the control groups. It comprised with the Stanford employee before the 1967, and the treatment groups in this case basically are the same group of employees with the same characteristics, but after the policy change, who has to pay more now for doctor visits. Comparing to the control groups and the treatment groups visits, the doctors, there are about 24% less of the visits it's being recorded after the policy change. So this gives us some very, very important suggestions that the exposed moral hazards actually engage, because people with more generous plan, they would actually use more of the service. So even with a very small minor problem, they will still go to the doctor visits because they know it. Everything they get from the doctor, it's going to be free. On the other hand, we also find some very similar results from the RAN-HIE surveys. In the surveys, we actually found that those people with the free plans or the full coverage plans, they are definitely more likely to visit the hospital comparing to people who has a partial coverage plans. In Germans, also we found this one study, which is done by Ortmans in 2011. The study actually using a data from Germany's small private health insurance industry that examines the impact of deductible size on expenditures for outpatient service. Well, the study actually suggests that the deductibles in Germany are associated with a significant cost saving up to about 35% of the total outpatient expenditures. But what's interesting to note is the study also found that the introducing deductible in the insurance plan can actually lead to reductions in health insurance premium that actually exceeds the amount of the deductibles, so leading to a decline in the total payment for all the customers. This is evident that actually curbing the moral hazard in this way, why indeed saving money for everybody by decreasing the total amount of healthcare consumed. Also in Canada, we found another study that also suggesting the size or illustrating the size of exposed moral hazards. So in this study, all Canadian residents have access to free appointments with the primary care physicians, but only some Canadians will have the prescription drugs coverage. So in this case, we have two groups of people who can go to the doctor free and also the free drugs, but also another group of people go to the doctor free but maybe have to pay for the drugs it's been prescribed. The study actually finds those who rarely visit the doctor start visiting the doctor much more often when they obtain the prescription drugs coverage. And they speculate this is because the patient began to substitute prescription drugs for over-the-counter drugs when they no longer have to pay full price for the drugs. So all this evidence actually give us some insight of how the exposed moral hazards it's being studied in the markets. However, it's still a very, very difficult task sometimes to identify the difference between the exposed moral hazards and ex-ante moral hazard, because it's just it's very possible that both of these moral hazards happen at the same time and they have different level of influence to people behaviors. So after talking about the moral hazards in many different ways, of course, moral hazard is a byproduct of insurance contract. It creates social laws. However, the true policy questions that we should ask is whether the insurance policy that create more hazard should be permitted. Because even with the social loss, if the insurance still providing enough benefits to reduce uncertainty and risk for people in the markets, the benefits still outweigh the cost, right? So should we actually consider not only just the cost of this problem, but also consider the benefits of it? Just like the pollution problem that we face in production setting. So if insurance market is going to create more hazards that having the social loss created, the pollution problem, it's basically just like the similar case where the externality pollution from the productions, it's being introduced to the markets, where usually the government will have to step in either to tax the manufacturers to reduce the level of pollutions, or to reduce the level of outputs to the optimal levels, or maybe to regulate the markets. So the question to ask is, should the provisions of insurance be similar to the ones in the productions of other products that create pollutions? Should we actually tax the insurance company, or maybe the insurance buyer, or should we even just ban the whole market in order to reduce the level of social loss? I would say most of the economists will answer this question saying no. Well, one of the logical reasons to believe is insurance market actually creating this positive welfare to the society, where it actually reduce the risk-averse individuals of uncertainty in life in order to gain utility in the markets. However, yes, sometime we might actually expect this positive welfare might actually offset the harms of the moral hazards. But also we have to find a balance of it. So the asymmetric information creating a trade-off between insurance and other things. So for example, with more insurance coverage introduced in the markets, it generates more and more hazard case in the markets. On the other hand, if we are going to reduce the insurance coverage, less of the insurance coverage means the risk-averse individual will have to face more of the risk or more of the uncertainty in life. So it increases the risk exposure to individuals in the society. In general, we don't want to actually get into the analytical or the technical parts of these sections here. We just want to briefly go over the difference between optimal insurance in the public markets and also the private markets. So in the private markets, we believe if the market is perfectly competitive, there are many sellers and many buyers of insurance, somehow the market can figure out by itself. So the private market can navigate the trade-off between the moral hazards and also an insurance in order to provide the maximum or optimal contracts in the markets. However, there are countries in the world start moving towards what we call the public insurance system. So providing national insurance, or by having the publics providing the insurance becomes so popular nowadays. So if the governments were to offer full insurance, and the result of moral hazard could actually cause the healthcare expenditure to balloon. So think about it. If taking the case, if one of the country in the world, they are telling their citizens, from now on, we are going to take some tax dollar from everyone's pocket, and by doing that, everyone can actually go see a doctor, do any surgeries, get any treatments, get any prescription drugs for free. Well, obviously, everyone will be taking advantage of this policy, and the moral hazard problem will inflate the healthcare expenses in the country. So in order to provide a more reasonable public insurance policy, it's quite a challenging job. Well, taking a case in the United States, well, Obamacare basically it's one of this public insurance policy that it's being introduced to the country and not getting a lot of credit for it. Well, first of all, this usually a public insurance, it's a non-voluntary policy, so everyone has to pay a price for it. And once they, the people paying the tax dollar on this policy, well, everyone will get the benefits of it. Well, they will be forced to enroll, and they will be covered by insurance, regardless you have the money to pay or not have the money to pay. However, this kind of government-provided insurance, they are usually very lacking of the self-corrective features. So that means it's hardly to see this kind of policy be able to balance the social loss from moral hazards and the social loss from uninsurance. So unlike the private markets, the public insurance markets somehow might actually benefit the people by providing everyone a safety net. However, it might actually creating more and more of one of these problems in the markets. So it's a very complex and critical problem to solve for a country like us to provide this public insurance policy in the country. So the optimal policy or the optimal contract provided in the country, it's somehow relatively difficult. Well, at last of these chapters, I know this is a very, very long chapter, but it's a very, very informative chapters that I would suggest everyone to read. So there are so much of a negative side of moral hazard we have talked about. The last sections of this chapter, we are going to go over some upside of moral hazards. So not only the negative things that we will find from moral hazards, sometimes the moral hazard actually providing us some positive influences to the society. So the upside of moral hazards include the extra preventive care. So for example, evidence found from RAND HIE survey and Oregon Medicaid experiment and elsewhere indicates people with insurance, they usually will take advantage of this insurance as long as they know they don't have to pay a lot out of pockets for the preventive care or maybe other types of care. They might actually engage in this exposed moral hazards. So it's free to do preventive care. Let's say a flu vaccine is free. People will take advantage of it and take that vaccines. So this is a beneficial effect if only if people consume less preventive care than they should. But of course, in most cases, people in general is not taking enough preventive care in the markets. So by having people taking advantage of the moral hazards by changing their behavior and using more of this preventive care, actually somehow it reduces people getting into serious trouble later. On the other hand, the income effect also play a role. In general, the health insurance provide a benefits income effect to customers in addition to the risk reductions. So for example, we might actually consider individuals who with a total assets of, let's say, $10,000 who were diagnosed with cancer. And there's a cost of treatments that will cost about, let's say, $500,000 out of pocket, and also there's another $1 million worth of benefits to the patients. It's being provided. Unfortunately, this person cannot afford the treatment and cannot get access to the credit for the loan, so he basically has to go without any of these treatments. But at the same time, if this individual is being diagnosed with the cancer with the same total assets in his bank account, but now he's being covered with insurance, well, then the treatments only cost him, let's say, $3,000 out of pocket, and the rest of the money will be covered by the insurance plans. So it still provides the same large benefits in this situation, well, this person decided to go forward with the treatments, and the insurance contract turns him into a much richer man that can afford the expensive treatments. So in this specific case, obviously the insurance does induce the behavior change for these individuals. So it might actually fall under what we define as moral hazards. But at this time, of course, the social benefits actually gain much more, because this individual person actually get access to the treatment that's well worth it. It's saving life, basically. So the possibility of efficiencies of moral hazards basically means that the optimal contract is more full than if the income effect is ignored. When we account for full benefits of insurance, including the risk reductions and the income effect, the optimal level of insurance is actually higher than what's indicated. In general, I would say it's almost impossible to understand the way health insurance work without understanding both the adverse selections that we studied in the previous chapter and moral hazards in this chapter. Every insurance scheme, actually privates or publics, throughout the world must consider the problems of the both. The existence of moral hazards actually explains why is it so difficult for both markets and governments to provide full financial insurance against the health risks for the public. Insurance products in the real markets are always necessarily incomplete, because the fact that with the moral hazards, there are always some way that we have to reduce the price distortions in order to reduce the level of moral hazards in the markets, such as putting the co-insurance, the co-payments, the restrictions such as the gatekeeper for specialty care, or the deductible policy. So all of this basically are used to eliminate or maybe to reduce the level of moral hazards in the markets. So for private insurers, being able to tell the difference between appropriate and inappropriate care might actually mean that they can change lower premium than their competitors. For the governments, on the other hand, being able to distinguish the proper care might actually mean lower tax rates and electoral success. The stakes in combating the moral hazard problems are high for both private and public entities. Well, in chapter 14, we are going to study what we call the cost effectiveness analysis. This is a primary tool for many of the insurers and governments in the market to use in order to measure the worth of the new technology introduced in the healthcare markets. Of course, adoptions of this new technology by providers pose a very big challenge in today's day because of the moral hazards. With more expensive technology introduced, that means the moral hazards will actually increase in the markets, or maybe inflating even higher costs for these healthcare services. So in general, we have already finished the topics on insurance markets in general. Only 3 chapters we have covered, we know, but the adverse selections and moral hazards, they are the 2 main issues. Still at this day, we as a health economist couldn't find the perfect solution to it. There are some policy tools that we might be able to comply in order to eliminate some level of this problem, but in general, still it's a very challenging issue for all the countries in the world to solve. So I would strongly suggest you to go back to your textbook and read this chapter, or maybe even the previous chapter one more time, in order to get a very good sense of both topics. Because later we are going to pick up some topics that closely related to both the adverse selection problem and moral hazard problem in the later chapters. And also, don't forget, these are the 2 topics that could definitely helps you to write your papers for the finals. So I will see you next time.